So essentially, psychiatric nurse practitioners are an advanced practice registered nurses, and they have specialized training in mental health. They provide a range of mental health services, including assessments, diagnosis, and treatment. They can either hold a master's or a doctoral degree. So the master's degree would be MSN, and the doctoral degree would be DNP. What is up, everybody? Welcome back to the channel. My name is Phil Sarpon. This is Phil's Guide to PsyD. This channel is dedicated to all things psychology, wellness, and graduate school. I've been getting a lot of questions lately about the differences between a psychiatric nurse practitioner, a psychologist, and a psychiatrist. I have done different videos about what each of those types of careers do and what they are, but I think it would be really good to just do an overall summary video of these three different types of careers and what to look out for in terms of application and potentially going into one of these fields. Now, if you have not already, please subscribe to the channel and hit the bell for notifications if you want to get notifications about future videos that we do in the future. Now, as we get into it, let's start with being a psychiatric nurse practitioner. So essentially, psychiatric nurse practitioners are an advanced practice registered nurses, and they have specialized training in mental health. They provide a range of mental health services, including assessments, diagnosis, and treatment. They can either hold a master's or a doctoral degree. So the master's degree would be MSN, and the doctoral degree would be DNP. They will have a specialized focus in psychiatric care, but they can either have a master's level degree or a doctoral level degree. They are trained to provide both psychotherapy and medication management. Now, depending on what state you live in, there are some states that give psychiatric nurse practitioners a lot more freedom and independence to practice independently. Now, there are other states, on the other hand, where a psychiatric nurse practitioner would have to practice under the licensure of a psychiatrist, or at least maybe they would be independent, but when it comes to medication management, they would have to consult or refer a lot of their clinical decision making. So that's definitely one thing to be aware of if you are in a state that has a little bit more restrictive focus on psychiatric nurse practitioners. Now, as I mentioned before, the treatment focus for psychiatric nurse practitioners is doing a combination of therapy and medication. Depending on the setting, there could be some settings where a psychiatric nurse practitioner, for example, is in a hospital and they might only primarily be doing medication management. There's other settings where they could be in a community-based setting and they're only doing therapy and a little bit of medication management. And so it really does depend on the setting in terms of if the psychiatric nurse practitioners are gonna focus more on medication or if they're gonna also focus on therapy or a combination of both. I know a lot of psychiatric nurse practitioners who have their own private practice who mainly do therapy with a little bit of the medication consults as well. So it really does depend. Now, one thing that I want to clarify from my other video that I talked about in terms of the major difference between a psychiatric nurse practitioner and a psychologist, it is true that both psychologists and psychiatric nurse practitioners do assessment. But the types of assessment that they do is clearly different. With psychiatric nurse practitioners doing more medical-based assessments in terms of looking at the patient's medical chart history and their medical diagnosis and different things like that, the psychologist is going to do neuropsychological assessment or psychodiagnostic assessment, whether it's looking for personality disorders, whether it's looking for neurological disorders like ADHD, dementia, dyslexia, some of those different things. In terms of psychologists will actually give typically paper and pencil tests to their patients, and then after that they'll score the test. And then after that, they'll write a report on that test. And then after that, they'll give some feedback, guidance in terms of the reports that they found from the assessment, right? So this could be different recommendations for neuropsychology testing or recommendations for psychiatric testing as well. So this leads us into really primarily talking about psychologists. Psychologists are mainly going to go from a bachelor's degree and maybe potentially a master's degree, but mainly going into a clinical psychology program, whether a PhD or a PsyD program. They could also pursue a counseling PhD program as well. That program is anywhere from 4 to 6 years. And then after that, they would go into a 1-year internship. Typically, depending on what state that they live in, they'd have to do a postdoc. And then after that postdoc, they could go into licensure. There may be some types of specializations like neuropsychology or health psychology in which the psychologist could actually get additional training and become board certified in their specific specialty. So that is how to become a psychologist, and what psychologists will do is typically therapy and, as I mentioned before, the assessment. They can also do research and teaching and supervision and consulting and all of those different things. But the thing that really differentiates them from psychiatric nurse practitioners is going to be the neuropsychological testing and the psychodiagnostic testing. Now, there are some programs that might teach some of those things to psychiatric nurse practitioners, but I have not seen psychiatric nurse practitioners actually implement a lot of that learning or that training. They might have a little bit of it. They might obviously still be able to diagnose things like ADHD or dementia, but the way that they go about those diagnoses are going to look a little bit different than the way that psychologists might diagnose those disorders. And so that's just important to keep in mind. The main thing about psychologists is they write those reports, and those reports can be anywhere from 8 to 10 pages. Psychiatric nurse practitioners are not writing reports that are that long, right? So that is something that is kind of unique for psychologists, in that we do a lot of research and teaching and writing of the assessments that we give to be very thorough in terms of the diagnosis that we make, whether it's some type of psychological disorder or some type of mental health or neuropsychological disorder as well. And then finally, we have psychiatrists. Psychiatrists will go through their own form of education, whether it's a bachelor's degree, maybe a master's degree, but typically they'll go into medical school, and after medical school they'll go into residency, and then after residency they can go into certification and become psychiatrists. Now, for psychiatrists, they could either be a medical doctor, an MD, or a DO. They can prescribe medication, and they can also provide psychotherapy. Them being a psychiatrist, mainly in hospital settings and clinical settings, they're primarily going to focus on medication management. If they are in private practice, of course, they can choose either therapy or medication management, but typically in those community-based mental health settings, they're going to be doing a lot of psychiatric medication management. Now, here are some of the key differences that you really have to consider if you're trying to figure out whether or not to go into this career. The first thing is obviously prescription authority. Psychologists do not have prescription authority. We're not able to prescribe medication. And here's the thing. Now, it is true that in certain states, psychologists could get an additional master's level degree in psychopharmacology and be given prescriptive authority, but they would have to do a whole additional layer of training on top of their doctoral degree, their internship, their postdoc, and their board certification. So that is way more work than most people are willing to do, but it is technically possible in certain states. But typically, you're going to have psychiatric nurse practitioners and psychiatrists who can prescribe medication. Now, again, there are some limitations for psychiatric nurse practitioners depending on where they get their licensure and what state that they live in. There are obviously differences in training. Psychologists go to PhD or PsyD programs, psychiatrists go to medical programs, and then obviously psychiatric nurse practitioners go through their own type of programs. It gets a little tricky with psychiatric nurse practitioners because there's a lot of different ways that you can become a nurse. You can have an associate's degree in nursing, you can have a bachelor's degree in nursing, obviously you can have a master's degree in the psychiatric nurse practitioning, and you can also get a doctoral degree in the doctoral nurse practitioning degree with a focus in psychiatric nurse practitioning. But here's the thing, there's a lot of advanced level programs where people can go to nursing school for 6 months, 9 months, a year and a half and get a bachelor's degree in nursing. So it is very possible, depending on what state that you live in, depending on what program that you choose, that you can become a nurse in no time. But typically, you are going to have to at least pass the NCLEX in order to get into some of these master level programs and become a psychiatric nurse practitioner. So that is big. I know a lot of people are like, oh, I could just jump into this and do this. But depending on the state, depending on the jurisdiction, depending on the program itself, you still may have to have certain classes that you've already taken, or at least have some type of prior nursing degree, or at least have passed your NCLEX, or at least have been practicing as a nurse in order to get recommended or get admitted into some of these master level programs where you can then finally become a psychiatric nurse practitioner. If you already have a nursing degree and you want to go into the mental health field, I think a psychiatric nurse practitioner is a great option for you. It's probably the least amount of time that you'd be able to put into in terms of getting that degree and becoming a psychiatric nurse practitioner. And you'd be able to do more things than a psychologist and actually prescribing medication. So that's a great option. If you don't have a prior nursing degree, then a psychologist might be a great option for you if you just want to mainly focus on therapy and assessment. And of course, if you want to have that medical background and you still also want to prescribe medication, then a psychiatrist might be also a really good option for you. Psychiatric nurse practitioners are going to be the ones to prescribe the medication, but they'll refer their patients to a psychologist for long-term therapy, and then they might consult with a psychiatrist if the mental health of the patient is really complex. But overall, all three careers can work in private practices, can work in hospitals and clinics, and school settings, research settings. They can teach, they can consult, they can supervise, they can work in various different healthcare settings. Those are some of the similarities and the differences between a psychiatric nurse practitioner, a psychologist, and a psychiatrist. If y'all have any questions, definitely put it down in the comment section below. If you have not already, please subscribe to the channel, and I will see you all in the next video.